Welcome back to the channel. Today we're diving into an important topic for anyone managing diabetes or looking to optimize their blood sugar levels. We're going to break down some key vitamins and how they play a role in keeping those numbers in check. Now, remember, I'm all about giving you the knowledge you need to take control of your health, but it's always best to chat with your doctor before making any major changes to your diet or supplement routine. They can give you personalized advice based on your unique needs. We'll be discussing the top 3 vitamins that can help lower blood sugar levels and how you can incorporate them into your daily life. Let's get started. First up, we've got vitamin D, often called the sunshine vitamin. This essential nutrient is unique because our bodies can produce it when our skin is exposed to sunlight. It's like a little gift from the sun to us, because our bodies produce it in response to sunlight. When UVB rays from the sun hit our skin, a chemical reaction occurs, converting a type of cholesterol in our skin into vitamin D3. This then gets processed by our liver and kidneys to become active vitamin D. But vitamin D is not just about strong bones. It also plays a crucial role in regulating blood sugar. This is particularly important because maintaining balanced blood sugar levels is essential for overall health and well-being. Studies have shown a link between vitamin D deficiency and an increased risk of type 2 diabetes. Researchers have found that people with lower levels of vitamin D are more likely to develop insulin resistance, which is a precursor to diabetes. Why is that? Well, vitamin D actually helps our bodies use insulin more effectively. Insulin is a hormone produced by the pancreas that allows your body to use sugar from carbohydrates in the food that you eat for energy or to store glucose for future use. Insulin is like a key that unlocks the doors of our cells, allowing glucose from the bloodstream to enter and provide energy. Without enough insulin, or if the insulin doesn't work properly, glucose can't enter the cells and stays in the bloodstream, leading to high blood sugar levels. When your body doesn't produce enough insulin or can't use it properly, that's when blood sugar levels can rise, leading to diabetes. This condition can cause a range of health issues, from nerve damage to heart disease. Vitamin D swoops in to improve insulin sensitivity, meaning your body can use insulin more efficiently to unlock those cell doors and keep those glucose levels in a healthy range. This is why maintaining adequate levels of vitamin D is so important for metabolic health. Think of it like this. Vitamin D is like oiling the lock. It helps that insulin key work smoothly and efficiently. Without enough vitamin D, the lock can become rusty, making it harder for insulin to do its job. So, how can you make sure you're getting enough vitamin D? Spending some time in the sun is great, but obviously we need to be careful about sun exposure. Too much sun can increase the risk of skin cancer, so it's important to find a balance. Good food sources of vitamin D include fatty fish like salmon, tuna, and mackerel. These fish are not only rich in vitamin D but also provide omega-3 fatty acids, which are beneficial for heart health, as well as egg yolks. Eggs are a versatile food that can be included in many different meals, making it easier to boost your vitamin D intake. And fortified foods like milk and cereal. Many dairy products and plant-based milk alternatives are fortified with vitamin D, making them a convenient option for increasing your intake. If you're concerned about your vitamin D levels, talk to your doctor about getting tested. A simple blood test can determine if you have a deficiency and help you take the necessary steps to correct it. They can recommend the right dosage of a supplement if needed. Supplements can be an effective way to ensure you're getting enough vitamin D, especially during the winter months or if you have limited sun exposure. Next up is vitamin B12, a crucial nutrient that often doesn't get the attention it deserves. It's a powerhouse when it comes to energy production and nerve function, making it especially important for those managing diabetes. Vitamin B12 plays a vital role in converting the food you eat into glucose, which provides you with energy. Without adequate levels of this vitamin, you might find yourself feeling fatigued and sluggish, which can be particularly challenging for diabetics who need to maintain their energy levels. Now, you might be thinking, what does this have to do with blood sugar? The connection might not be immediately obvious, but it's incredibly significant. Well, here's the connection. Vitamin B12 is essential for the proper metabolism of a certain medication commonly prescribed for type 2 diabetes, metformin. Metformin is a cornerstone in the management of type 2 diabetes, helping to lower blood sugar levels effectively. Metformin helps lower blood sugar levels, and vitamin B12 ensures your body can use it effectively. Without sufficient vitamin B12, the efficacy of metformin can be compromised, making it harder to manage your blood sugar levels. Not only that, but vitamin B12 deficiency can sometimes lead to a condition called peripheral neuropathy, a common complication of diabetes. Peripheral neuropathy is a condition that affects the nerves, often causing discomfort and pain. This condition causes tingling, numbness, and pain in the hands and feet. These symptoms can be quite debilitating, affecting your quality of life and making daily activities more challenging. By ensuring you have adequate vitamin B12 levels, you can help prevent or manage these uncomfortable symptoms. Regular intake of vitamin B12 can support nerve health and reduce the risk of developing peripheral neuropathy. So, how do you boost your vitamin B12 intake? It's simpler than you might think. Incorporating a variety of foods rich in vitamin B12 into your diet can make a significant difference. Animal products are the best sources, including meat, poultry, fish, eggs, and dairy products. These foods are naturally high in vitamin B12 and can help you maintain adequate levels. For my plant-based friends, it's essential to include fortified foods like plant-based milk, nutritional yeast, or consider a B12 supplement. Fortified foods are specially designed to provide the nutrients that might be missing from a plant-based diet. Again, it's always a good idea to discuss your diet and any potential deficiencies with your doctor. They can provide personalized advice and help you determine the best way to meet your nutritional needs. They can help you determine if you need a little extra B12 boost. Taking proactive steps to manage your vitamin B12 levels can have a profound impact on your overall health and well-being, especially if you're managing diabetes. Last but certainly not least, we have magnesium, a mighty mineral involved in over 300 bodily functions. This essential nutrient is often overlooked, but it plays a pivotal role in maintaining our overall health. From muscle function to nerve signaling, magnesium is a true multitasker in our bodies. One of its most critical roles is in blood sugar control. Magnesium is a key player in helping our cells use glucose for energy. When we consume carbohydrates, they are broken down into glucose, which then enters our bloodstream. Magnesium helps ensure that this glucose is efficiently transported into our cells, where it can be used to fuel our daily activities. Think of magnesium as a traffic director, guiding glucose into the cells where it can be used effectively. Without adequate magnesium, this process can become less efficient, leading to higher blood sugar levels and potential health issues. When magnesium levels are low, our cells become less responsive to insulin, a hormone that helps regulate blood sugar. This condition, known as insulin resistance, can lead to higher blood sugar levels and increase the risk of developing type 2 diabetes. Insulin resistance is a significant health concern, and maintaining adequate magnesium levels can be a crucial factor in preventing it. Several studies have shown a link between magnesium deficiency and an increased risk of type 2 diabetes. Research indicates that people with lower magnesium levels are more likely to develop this chronic condition. This connection highlights the importance of ensuring we get enough magnesium in our diets. The good news is that increasing your magnesium intake may help improve insulin sensitivity and blood sugar control. By boosting your magnesium levels, you can enhance your body's ability to manage glucose and reduce the risk of insulin resistance. One study found that magnesium supplementation significantly reduced fasting blood glucose levels and improved insulin sensitivity in people with type 2 diabetes. This finding suggests that magnesium could be a valuable tool in managing and potentially preventing this condition. So, how can you up your magnesium game? Incorporating magnesium-rich foods into your diet is a great place to start. Not only do these foods provide essential nutrients, but they also offer a variety of other health benefits. Leafy green vegetables like spinach and kale are excellent sources of magnesium. These greens are not only rich in magnesium but also packed with vitamins and minerals that support overall health. Adding a handful of spinach to your smoothie or enjoying a kale salad can be a delicious way to boost your magnesium intake. Nuts and seeds, such as almonds and cashews, are also great sources of magnesium. These nutrient-dense snacks are perfect for on-the-go munching and can easily be added to your meals. Sprinkle some nuts on your yogurt or oatmeal for a crunchy, magnesium-rich boost. Other excellent sources include black beans and avocados. Black beans are not only high in magnesium, but also provide a good amount of fiber and protein. Avocados, on the other hand, are a versatile fruit that can be added to salads, sandwiches, or enjoyed on their own. And let's not forget dark chocolate. Yes, you heard that right, dark chocolate. This delicious treat is surprisingly high in magnesium. However, it's important to enjoy it in moderation to avoid excess sugar and calories. While it's tempting to indulge, moderation is key, especially when it comes to chocolate. A small piece of dark chocolate can be a delightful and healthful addition to your diet. If you're considering a magnesium supplement, it's best to consult with your doctor to determine the appropriate dosage for your needs. Supplements can be a convenient way to ensure you're getting enough magnesium, but it's important to use them wisely and under professional guidance. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips. Remember, taking care of your health is a journey, not a destination. Every step you take towards a healthier lifestyle counts. Leave a comment below if you have any questions or topics you'd like us to cover next. I love hearing from you guys. Until next time, stay healthy, friends.